Hi, welcome to our podcast. We are the team at Celeste Brain Health where we treat a variety of neurologic conditions. I'm Kelly Gill, PA, and this is Dr. Sumal Modi. We're here to talk to you about common neurologic conditions and preventative brain health. Let's dive in. We're diving into a topic that's often shrouded in mystery and even a bit of fear: epilepsy.
Thanks for having me, Kelly. It's great to be back. And you're right, epilepsy is a condition that many people don't fully understand.
I think a lot of people associate epilepsy with seizures, but there's so much more than that, isn't there?
Exactly. Epilepsy is a complex neurological disorder with a wide range of causes and manifestations. It's more common than you might think, affecting millions of people in US alone.
So let's break it down for our listeners. What exactly is epilepsy?
At its core, Kelly, epilepsy is characterized by recurrent seizures. These seizures are caused by abnormal electrical activity in the brain, sort of like a sudden surge of energy that disrupts the normal brain function.
And the seizures, they can manifest in several different ways, right?
Absolutely. Some people might experience convulsions where their body shakes uncontrollably. Others might have more subtle seizures, like staring spells or brief moments of confusion. The type and severity of seizures can vary greatly depending on the individual and the area of the brain that's affected.
That must be incredibly disruptive to someone's life. What kind of impact does epilepsy have on individuals and their families?
The impact can be significant, Kelly. Frequent seizures can make it difficult to hold a job, drive a car, or even perform everyday tasks. There is also emotional toll, with many people living with epilepsy experiencing anxiety, depression, and social stigma. And of course, there is a financial burden of medical expenses at lost productivity.
It sounds like it affects every aspect of a person's well-being. And what about the causes of epilepsy? Is it something people are born with, or can it develop later in life?
Both actually. Some people have genetic predisposition to epilepsy, while others develop it due to factors like head injuries, stroke, brain tumors, or infections. In many cases, the exact cause remains unknown.
So let's talk about diagnosis and treatment. How is epilepsy diagnosed, and what are the options for management?
Diagnosis typically involves a combination of things, Kelly. We'll take a detailed medical history, including any family history of seizures. An EEG or electroencephalogram can help detect abnormal brain activity. And in some cases, we might order imaging studies like MRI to look for any structural abnormalities in the brain.
And what about treatment? Is there a cure for epilepsy?
While there is no cure for everyone, the good news is that most people with epilepsy can achieve good seizure control with medications. These medications work by stabilizing electrical activity in the brain, reducing the frequency and severity of seizures.
That's reassuring to hear. Are there any other treatment options besides medication?
Yes, there are. For some people who don't respond well to medication, surgery might be an option. This involves removing the area of the brain where seizures originate. Other options include vagus nerve stimulation, a device implanted under the skin that sends electrical impulses to the brain, and also special diets like ketogenic diet, which can help reduce the seizures in some individuals.
It sounds like there's a whole range of approaches depending on the individual's needs.
Exactly, and it's important to work closely with a neurologist to find the best treatment plan for each person.
Now, Dr. Modi, I know that there's still a lot of stigma surrounding epilepsy. What can we do to change that?
Education is the key, Kelly. The more people understand about epilepsy, the less fear and stigma there will be. It's also important to challenge misconceptions and stereotypes. People with epilepsy can lead full and productive lives, and we need to support them in doing so.
Absolutely. And to our listeners, if you or someone you know has epilepsy, remember that you're not alone. There are resources and support available to help you manage this condition and live your best life. This has been another informative episode, Dr. Modi. Thanks again for coming in.
My pleasure, Kelly.
And to our listeners, thank you for tuning in. We'll catch you next time for another fascinating exploration of the mind.